Over the last 4 decades, we've made tremendous progress in the fight against HIV. What was once a death sentence is now a manageable chronic condition for millions around the world. Life-saving treatments such as antiretroviral therapy and preventative tools like PrEP, pre-exposure prophylaxis, have changed the landscape of this epidemic. We now know that undetectable equals untransmittable, U equals U, a truth that offers hope, dignity, and a path forward. But progress cannot pause, and neither can we. Because new infections still occur, especially among young people, LGBTQ communities, and communities of color. Stigma and misinformation continue to isolate people and delay testing for treatment. Healthcare inequities still deny many access to care they need and deserve. Complacency is dangerous. When we stop talking about HIV, when we stop educating, we risk undoing the gains we fought so hard to make. So, what does not pausing look like? It looks like getting tested regularly, openly, and without shame. It looks like fighting stigma in our schools, workplaces, and families. It looks like supporting those living with HIV with compassion and community. It looks like investing in prevention and education, especially for the next generation. It looks like speaking out, even when it is uncomfortable. This month, we remember that HIV is not over, but neither is our fight. We honor the lives lost. We uplift those living and thriving with HIV, and we recommit ourselves to a future free of stigma, silence, and new infections. Because progress can't pause, neither can we. With that, ladies and gentlemen, it gives me pleasure to introduce at AIDS Delaware, our Director of Operations, Ms. Laura Rydell.
Thank you. Thank you. I'm here representing also our Interim Executive Director, Christopher Moore, who unfortunately was not able to be here today, but it's my honor and pleasure to deliver his remarks to everyone. Today we're sounding the alarm, code red alert, because while we've made extraordinary progress in the fight against HIV, this is not the moment to slow down. Here is a personal story from Christopher that I would like to share with everyone. In 2002, AIDS Delaware was the first place that he got an HIV test. He was in his early 20s, and he remembers walking into the office with his heart pounding, nervous, terrified actually. There was so much fear back then, not just about HIV itself, but about what people might think if you got tested. But the person who sat across from him that day didn't see fear. They saw him, the person. They didn't shame him or rush him. They talked with him. They explained every step. And in that small room, what he felt wasn't fear anymore. It was care. That kind of compassion, that ability to meet people exactly where they are, without judgment, that's the heart of AIDS Delaware, then and now. And for more than 40 years, that is who we have always been. Today, people still come to us with that same mix of fear and hope. They come looking for someone to listen, someone to guide, someone to remind them they're not alone. And our team, many are here today, our medical case managers, mental health counselors, educators, they answer that call every single day. HIV is not over. People are still being diagnosed. Stigma still silences too many voices, and far too often, the programs that save lives are the first to face cuts when budgets get tight. And that's why we're here today. To say as clearly as we cannot afford to pause. not for a new budget cycle, not for the next legislative session, not for someone else to take the lead. AIDS Delaware will meet this moment. We will keep expanding access to PrEP. We will keep supporting people living with HIV so that no one has to choose between paying rent, buying food, or filling prescriptions. We will keep fighting stigma through education, outreach, and honest conversation. And we will keep partnering with our friends in public health, in government, and across our community, because this work only succeeds when we do it together. Every test offered, every client supported, every barrier broken, it all adds up to progress, and progress cannot pause. As we begin HIV Awareness Month, let this code red alert be our reminder and our promise. We will keep showing up, we will keep speaking out, and we will keep doing the work because lives depend on it. Christopher will never forget that first visit to AIDS Delaware, the calm voice, the kindness, the simple humanity that turned fear into relief. That's what this organization has always been about, and that's what it will continue to be about. So yes, the alarm is sounding, and we are answering it, because progress cannot pause, and neither can we. Thank you. And now it's my pleasure to introduce the Lieutenant Governor, Kyle Gay.
Thank you. Well, good morning, everyone. It's an honor to be here to support Christopher, Frank, and the whole team. Thank you for everything you do. I know we have advocates and health professionals and community leaders, and most importantly, we have people living with HIV at this powerful gathering. I want to thank AIDS Delaware for hosting us, for marking this month, and for more than 4 decades of unwavering leadership in this fight. Today's theme, as you've heard, progress can't pause, and neither can we, reminds us of 2 truths. First, that we have achieved remarkable progress. And second, that progress on its own is not permanent. It's something we must continue to protect, to build on, and to renew every single day. When we look back, we see how far we've come. As you heard earlier, what was once a deadly disease, only discussed in whispers, is now manageable as a chronic condition. People can live with it, thrive with it, and thanks to science, community activism, and policy rooted in compassion and equity, Delaware has continued to support and protect its population. We've expanded access to testing, we've supported prevention tools like PrEP, and we've ensured that treatment is available to anyone who needs it. But as we know, progress doesn't move in a straight line. The pandemic tested us, it tested our systems, it strained our healthcare workforce, and it widened inequities that unfortunately still persist. We've seen how quickly momentum can slip away if we take our eyes off the goal. That's why we cannot pause. We cannot pause until every Delawarean has access to affordable, stigma-free healthcare. We cannot pause until every person living with HIV feels seen, supported, and safe in their community. We cannot pause until prevention and education reaches every corner of our state. The work of AIDS Delaware and all the partners represented here and across the state reminds us that this is not just a public health issue. It's a human rights issue. It's about dignity, inclusion, and justice, and those values don't stop at the clinic door. They must be reflected in our policies, our classrooms, our workplaces, and our conversations. As your Lieutenant Governor, I'm proud to stand with you in advancing this mission. Together with our state's Department of Health and community organizations, this administration is expanding outreach, investing in prevention, and strengthening mental health services that go hand in hand with physical wellness. Every person here today plays a role in ensuring that our progress continues. Whether you're a healthcare provider, a counselor, a policymaker, a family member, your courage and your voice matter. So let's keep moving forward. faster, and together. Let's honor those who we've lost by committing to this work, because progress can't pause, and neither can we. Thank you. I'll turn it back over to Frank.
No, you can do the part.
Oh, fantastic. Before I do, grab that for you. My apologies, I only,
I'm going to ask the other staff to come down too.
come on down. We'll wait for them.
Come on, Emma. You should. Valeria.
It's about everyone today. Come on over. Good to see you. Good, I'm so good, thank you. All right. All right, we've got a big group here. So, in recognition of HIV Awareness Month, I am incredibly pleased on behalf of the governor and myself and the administration to present this proclamation to AIDS Delaware and to say in writing and with my voice and with our actions that we stand with you and we stand with the community, and we thank you for leading this fight.
Thank you.
Are you angry? Oh, we're going to scoot in a little bit. I do this every day. Don't worry. Find your window. All right, good. Ready? All set? Great. Thank you. Thank you.
Thank you so much, Lieutenant Governor. We appreciate that. Now we're going to have some remarks. It's our pleasure to introduce the Newcastle County President, Monique Williams-John.
Good afternoon, everyone. Wonderful. Thank you so much for including me today and all those that are here. And, you know, we're recognizing HIV Awareness Month. And it's a time to reflect, to remember, and to reconnect ourselves to the work that still lies ahead. Today, we honor the courage of millions of people around the world who live with HIV and those we have lost along the way. We celebrate the strength, their resilience, and their unwavering hope. Their stories remind us that HIV is not just a medical condition. It's a human experience that touches families, communities, and hearts. Over the years, the courage and the resilience of people living with HIV, along with the compassion of communities and the dedication of health workers, have transformed the story of this disease. What was once surrounded by fear and despair has become a story of strength, progress, and humanity. But our journey is not yet over. Too many people still face the daily challenges of living with HIV without the care, the support, or understanding they deserve. Many still cannot access the life-saving treatments that allow others to thrive. And the weight of stigma, often heavier than the illness itself, continues to silence voices and isolate hearts. That is why HIV Awareness Month is so important. It reminds us not to only how far we've come, but how far we must still continue to go. Together, it challenges us to look beyond statistics and policies and to see the people, the mothers, the fathers, the sons and daughters, friends who are living proof of resilience and love. This month calls us to remember three important truths. Knowledge is power. Getting tested, knowing your status, and understanding how HIV is transmitted are acts of strength and self-respect. Education protects lives, and it replaces fear with understanding. Number two, compassion saves lives. Every person living with HIV deserves dignity, respect, and love, not not judgment and exclusion. When we stand with people instead of apart from them, we help build a community where no one feels alone. Number 3, together we can end HIV. The path forward is one of unity through awareness, advocacy, and action. We support each other, share information, and demand access to care for all. We move closer to a future where new infections are rare and treatment is universal. But let us use this month not only to raise awareness, but to open our hearts. Let us listen to the stories of those who live with HIV, not with pity, but with admiration. Let us continue to challenge myths, confront stigmas, and stand in solidarity with everyone affected. When we choose empathy over fear and community over stigma, we don't just fight HIV, we nurture hope. And hope shares and sustains is the most powerful medicine of all. So today and every day, let us be reminded that ending HIV is not only about science or medicine, it's about people. It's about compassion, equality, and the belief that every single life matters. So thank you to the staff that worked so hard, and we are here with you. Thank you.
All right, so moving right along, our next presenter or speaker is a gentleman who I admire and have had the opportunity of working with. He is Dr. Wayne Duffus. Dr. Duffus is the clinical leader for the Holloway Community Program, school-based wellness centers, and juvenile justice. Dr. Duffus.
Hello, good afternoon, and thank you for being here. As an infectious disease physician, my career is focused on caring for individuals living with HIV. I've witnessed significant changes from the dark days of the 1980s to the advancements we see today. We've come a long way since an HIV diagnosis was considered a death sentence. Let's remember how far we've come. When I began my medical training in the 1980s, an HIV diagnosis was still for many a death sentence. We have since lived through one of the most extraordinary public health revolutions: the discovery of effective antiretrovirals, the rollout of combination therapy, and the proof that early treatment prevents transmission. Since 1981, Delaware has recorded approximately 6,700 HIV diagnoses, with a disproportionate impact on Black residents. Key transmission routes include men who have sex with men and injection drug use, which are particularly concentrated in Newcastle County and in Wilmington City. By the mid-90s, combination antiretroviral therapy turned HIV from a fatal disease into a manageable chronic condition, reducing deaths and enabling viral suppression. Public health leaders have implemented essential programs, including testing initiatives and syringe exchange programs, focusing on harm reduction to prevent infections. However, stigma and structural inequities continue to hinder our progress, necessitating that we address root causes such as housing and access to care. Delaware, like the rest of the country, has seen profound transformations in the HIV landscape. Today, over 4,000 Delawareans are living with HIV, about 73% male, 27% female. By race ethnicity, 56% Black, 31% white, 9% Hispanic Latino. By age at diagnosis most recent, 28% were between 20 and 29, 32% were between 30 and 39, 21% was between 40 and 49, and 12% age 50 and older. Transmission routes among adult cases in the most recent data, 44% was men who had sex with men, 12.5% injection drug users, 29% heterosexual, and about 4.1% heterosexual contact with intravenous drug use. When you look at the geographic distribution, 60% of the people with HIV are living in Newcastle County, 24% in Sussex, and 14.5% in Kent. Most are on treatment and doing well, thanks to antiretroviral therapy. And because of that, in Delaware, nearly 3/4, or 75% of our patients have achieved viral suppression. That means not only do they live longer and healthier lives, they pay taxes, and undetectable equal untransmissible. That's one of the greatest public health triumphs of our lifetime. Christiana Care Holloway Community Program, of which I'm the clinical director, has been a vital provider of HIV care since 1986. In 2024, we directly served 2,039 individuals living with HIV and welcomed 181 new patients. Currently, over 4,000 Delawareans are living with HIV, and I'm proud to report that 93% of the patients in our clinic have achieved viral suppression, meaning they cannot transmit. Our commitment encompasses the management of hepatitis B and C, focusing on comprehensive health care and preventative services like PrEP. In my clinic, I do not see statistics. I see someone's father, mother, brother, sister, niece, or nephew. If progress stalls, the virus takes advantage. That's why we must act with urgency and unity. Since 2020, there's been a concerning rise in new diagnoses, exacerbated by the pandemic, disruptions to testing and outreach. Prevention funding is declining, impacting community organizations that are vital to our response. We have the tools to end the HIV epidemic, but we must act now. Among some of the things we can do is strengthen prevention and care funding. We need to normalize HIV testing. We should shorten the time from diagnosis to treatment. We should expand access to PrEP. We should address the social realities that fuel vulnerability. We should achieve data-driven equity. We should invest in public health workforce, and we should embrace innovation from long-acting injectable treatments. So in closing, I see what's possible in every patient who walks into my clinic that starts treatment and thrives. I see it in young people choosing prevention, in communities organizing for harm reduction, in leaders fighting to protect public health funding. This epidemic has taken too much, but we now have the tools. And if we have the will, we will end it. Now the choice is ours. Do we allow that progress to stall, or do we finish what we started? Thank you for your time.
Thank you, Dr. Duffus. And now, ladies and gentlemen, please help me welcome from V Pharmaceuticals, Kim Thomas.
Thank you, Frank. We are living in one of the most powerful moments in HIV prevention history, a true PrEP revolution. For the first time, we have multiple options that allow people to take control of their HIV prevention in ways that fit their lifestyle, their lives. PrEP stands for pre-exposure prophylaxis. It's a medicine that people who are vulnerable to getting HIV can take to prevent them from getting HIV. When taken as prescribed, it is highly effective, up to 99% effective. So how did we get here? In 2012, the FDA approved the first oral version of PrEP. In 2019, they approved their second oral version of PrEP. In 2021, they approved the first long-acting injectable form of PrEP. And now in 2025, we have a new long-acting injectable form of PrEP. We've gone from one pill to 2 injections. Since PrEP became available, we've seen HIV diagnosis decline in communities with strong awareness and access. But everyone is not benefiting from this equality or equally. Black and Latino communities, women, and people in the South continue to face barriers from stigma, misinformation, to lack of access. The revolution isn't just about the science, it's about equity, awareness, and access. So what are some of the barriers to PrEP? Stigma about HIV, sexual health, the lack of providers having knowledge or the willingness to prescribe PrEP, costs, transportation, insurance challenges. So what are the opportunities when it comes to PrEP? We need to normalize the conversations around PrEP and sexual health. We need to train providers and community workers, just like we do here at AIDS Delaware, to discuss PrEP confidently. We need to expand PrEP access points from pharmacies
to clinics, to mobile units, to telehealth. We need to empower people to take a more active role in their sexual health. Again, PrEP is more than medicine. It's empowerment, it's self-care, it's prevention that works. The PrEP revolution is here, everyone. But a revolution is only as powerful as the people who carry it forward. Let's continue to talk about PrEP, normalize its use, make sure that anyone who could benefit from PrEP has access to PrEP. I recently spoke to a woman who said PrEP gave her a peace of mind. Again, she said PrEP gave her a peace of mind. It puts her health in her hands. And that is truly what the revolution is about. Thank you.
So, ladies and gentlemen, there you have it, right? November is HIV Awareness Month, and it's Code Red Alert. It's an alert because we want people to take action with us, right? So, what we have planned for the month of November thus far is activities throughout the month that will highlight the seriousness of this disease. People will be getting tested live, right, to show and influence and encourage others to get tested. On November 19th, we're partnering with the Mid-Atlantic AIDS Education Task Training Center to host a workshop on HIV prevention. This coming Saturday, we'll be working with Duffy's Hope and a few other folks to do some education with youth and providing them with community service hours. So things will be happening during the month of November. Stay tuned. Go to aidsdelaware.org for more information on what will be happening. And please, by all means, join us on this Code Red Alert train. All right? Thank you and have a great day.